Hi, I am Dr.Avya Bansal, Consultant Pulmonologist and Sleep Disorder Specialist at Bombay Hospital and Medical Research Center. I want to tell you about the diagnostic services in our lung function department. Apart from having a lung function test, spirometry, lung volumes, and diffusion, we also have a device known as an Impulse Oscillometry and FeNO. Very often we see patients who are unable to exhale and unable to perform a lung function test. So how do we diagnose respiratory disorders in them? We use something known as an impulse oscillometry, which measures the tidal volume of a patient, uses frequency, and helps us understand whether it's an obstructive disease such as asthma, COPD, or a restrictive lung disease such as interstitial lung diseases. The IOS can be performed in patients who are scared, apprehensive, or unable to hold their breaths and exhale at a speed which is demanded by a routine pulmonary function test. Another test up our sleeve is called as FeNO, which is fraction of exhaled nitric oxide. What this basically does is it measures the nitric oxide exhaled in the air and tells us whether this patient would respond to inhaled corticosteroids. What this means is whether this is a type 2 inflammatory response or no. The level of nitric oxide measured in the breath helps us understand whether inhaled corticosteroids would be beneficial to the patient, in asthmatics typically. Also, it will help us to understand the response to therapy. If a patient is on a particular dose of inhaled corticosteroids, patient is well controlled, and the FeNO levels are downtrending, we are very confident to step down therapy. So these two tests help us improve our diagnostic and treatment modalities and help us titrate medication while dealing with chronic respiratory disorders such as asthma, COPD, and interstitial lung disease.